For our next section, we're going to jump into some mobilizations for the foot and ankle. This first section, I want to talk about non-weight bearing mobilizations, and the purpose, in keeping with the theme that we're trying to present with today's topic, is to do mobilizations that are performed in a functional way of how we actually walk. And so I'm first going to start with a group of manual techniques that you could do, thinking about heel strike to mid stance. And again, as a review, when we first heel strike, we're going to land on the lateral aspect of the calcaneus, which will create eversion of the calcaneus. And then, as we talked about earlier, we have plantar flexion and adduction of the talus, internal rotation of the lower leg, and as we create a flexible forefoot that's contouring to the ground, the forefoot is going to do the opposite of the calcaneus. It's going to be inverting against the ground as the ground reaction force doesn't allow it to evert or into the ground as the calcaneus does. So again, and keep this in your mind and on a cheat sheet, when the calcaneus everts, the forefoot will invert as the foot hits the ground. So I'm going to bring Manny in, and we're going to demonstrate some of these mobilizations. He's going to lay supine. And all of these mobilizations are going to be not necessarily going into like a grade 4 mobilization, but we want, grade 4. But we want to be able to have kind of a free leg that's going to generate the expected biomechanics. So I'm going to use my left hand in order to create calcaneal eversion, and use my right hand to do other kind of biomechanical tasks that we want to try to create. So the first, again, when the foot hits the ground, calcaneal is going to evert. I can get some distraction and eversion with, that's kind of the first and easiest one we can do. When I do that, I can get the lower leg to start to rotate into internal rotation. I can use my right hand to kind of guide the lower limb into internal rotation as I evert the calcaneus. The calcaneus is also going to have a component of transverse plane motion with ab and adduction, or internal and external rotation. So I can grab the calcaneus here with a little distraction and just do ab and adduction, internal and external rotation. It's synonymous with one another. Okay, you should feel a stretch there. Following that, we'll go down into the combination of the rear foot and the forefoot. So if I evert the calcaneus, I can also get some abduction of the forefoot. So I can kind of work with eversion, and with my right hand working into abduction of the forefoot, followed by calcaneal eversion and forefoot inversion when the foot hits the ground. Okay. Lastly, with calcaneal eversion, I can work on getting the first ray to dorsiflex as well as the midfoot to dorsiflex.